Good morning, everyone, and welcome to the first ever virtual Denver Human Services Community Network meeting. My name is Christopher Jorgensen, and I'll be your moderator this morning, and I'm so happy that you're able to join us. This is a unique time and space that we are all experiencing together, and I'm glad through the help of technology, we are still able to come together, celebrate what great things each of you do, and highlight programs that are making a difference to the mutual population that we all serve. All right, guys, so just a few quick tips and tricks to navigate this Microsoft Teams live event. During the event, we'll have an operating Q&A forum where you as an audience member can ask today's presenters questions or comment on the discussion at hand. To ask a question, select the Q&A button on the right side of your screen, type your question in the compose box, and then select send. If you want to ask your question anonymously, select the ask anonymously option and that will be sent. Q&A questions will be reviewed and posted to either the entire meeting or asked directly to our presenters. This event will also have live captions and subtitles in multiple languages. To turn on live captions and subtitles, select the Caption Subtitles On option in your video controls. To change the caption language, select Settings, Caption and Subtitles, and choose the language you want. Today's Community Network meeting is focusing on food and nutrition, as well as information regarding Denver Human Services and the current processes and procedures they have during these unprecedented times. I would like to introduce today's presenters. First up is Deputy Mayor and Executive Director of Denver Human Services, Don Mares.
Great, Chris. Thank you so much. Ready to rock and roll?
All right, awesome. Okay. Next up is our Division Director of the Family and Adult Assistance Division of Denver Human Services, Lorraine Sangsavath. Our Denver Human Services Drives and Donations Coordinator, Bryn Daly.
Hello all, I hope you're all well. Thank you so much for having me.
Our Deputy Division Director of Child Support Services and the Family and Adult Division of Denver Human Services, Christian Maddie.
Good morning, everybody. Hope you're staying cool on what's going to be a really hot day.
The Director of Client Services with Hunger Free Colorado, Brett Reeder.
Good morning, everyone. Happy to be here.
And the Manager of Programs and Outreach with the Food Bank of the Rockies, Chris Taylor.
Hi, good morning, everyone. Thanks for joining us.
Following our speakers' presentations today, we'll have time for you as the audience to ask any questions that you may have. So be sure to send them through your Q&A and we'll make sure that we address as many as possible. Another quick note, this presentation is being recorded and will be available to watch later for those who may not have been able to make it or would like to review content in the future. All right, so first up, we have Don and Lorraine to share some thoughts as we get this community network meeting underway.
All right, Chris, thank you for all you and the team have done to put this together. I think this is just phenomenal and one of those strange ways where we may be touching more people through this than otherwise. So thank you, and good to have everyone joining. Welcome. I wanted to start in kind of a different place, and that is, I'm not sure how many of you I have met or have worked with over my years. I wanted to just kind of let you know where I come from, because I think it has helped shape how I think about the work we're doing in human services. And both of my parents and myself, we're from the hood. You know, we're Northsiders, and I know that means something to some people, and still live in the North Side. And that really, to me, means something. It means that we are of and with the community, It really was such an honor when I was in the state legislature, in the House and the Senate, to represent the area that I grew up in up here in North Denver and in West Denver when I was in the Senate, because my dad is a West High and my mom is a North High grad. That's kind of why I'm all kind of messed up, I guess. But in any event, I think all of that life experience really shapes how it is that I think about the work of human services and our partners, the people who really work with this community and the people in need. So I just wanted to let you know that, because I don't know how many of you have known me and all the interesting things I've done in my career. So with that, let me just tell you, I really appreciate this chance to engage with you, and I really mean that, because we're in such an interesting time now in our service delivery and how we are helping people, that I think we're sort of, at least I am sort of really pining for feedback, and that's really what I asked Chris to allow me to do, is solicit feedback around how we're doing in this particular environment about helping people. And what I mean by that is that, just to kind of go back a couple steps, those of you who've worked with us for a long time know that probably we were one of the departments of human services in the region that did a heck of a lot of face-to-face stuff. We had a lot of clients come in our door. It really rivaled any other department. And frankly, we worked to do that. That was a part of our conscious mission, if you will, was if somebody wanted to come in our lobby, boy, we were going to help them. So fast forward then to COVID and March 17th or whatever fateful day it was when I made the decision, which now seems like a no-brainer, but back then it was a really hard decision to, in essence, close our offices and close our lobbies. And that meant that all the people we served who used to come in, or so many of them, had to completely pivot to doing this work via electronics if they had them. And of course, right away, we were scrambling to figure out what to do with people who either didn't have internet or would because they closed the libraries, so they couldn't even go there. I certainly was amazed at how well that pivot went. I think, and that's one of my questions. The employees have done amazing work, even though 90% of them, more than that, in our agency are working from home. We do have people coming in, but we pivoted in that way. So in the intervening couple months, and then I'm going to get to maybe asking you the questions. I've been thinking long and hard about how we serve those folks who are in need, those folks in our in our population of clients who are underprivileged a lot of times, who have worse health conditions, who COVID is hitting them worse because of their race and their station and their issues. And I'm thinking to myself, well, so what should the future look like? Should we reopen lobbies and just have everybody come back in? Those of you who've ever been through Bridges Out of Poverty training have heard the phrase agency time. And that's a phrase that speaks about how people who are poor and underprivileged spend a lot of time in lines, in buses, going somewhere to get what they need, when people who have privilege don't have to do that as much, or it's certainly a lot easier for those people with privilege. So I'm thinking, is there a paradigm shift that we should be considering here? Well, we are considering, but all of those thoughts and activities, to me, command input from the people who are really on the ground with us, and that's you all. So therefore, what I am hoping you will do for me in the next 5-ish minutes, and again, you can either put questions in the chat, you can wait with your questions, and we can, we'll take them up, or your thoughts about how are we doing serving people. What I'd like to know from you, if you would please share, and put it in the chat, and Courtney will read the question, we'll get Chris to read the question. How are we doing? Where do you think there are gaps? You're going to hear later about our runner program. Have we gotten that information out broadly enough so people know how to reach us? I want to know the good, the bad, and the ugly, because frankly, if we're not doing well, I need to be on top of it. So with that, few remarks to start us off. And I really hope that however many people are on this call, I can't imagine there are too many shy, quiet people in this group. So if you would be so kind as to start showing up with some questions in the chat, and some comments, tell us how we're doing. I'm all ears for the next 5 or 10 minutes, and want to hear. So that's the pitch.
All right, Lorraine, do you have any comments that you would like to add? Oh, Lorraine, I think you're on mute.
Okay, there's that gap. Thank you so much. I thought I had pressed unmute. Thank you, everyone. I was saying, how do you follow up with those remarkable statements from Mr. Mades? Good morning, everyone. Like Dawn mentioned, I grew up in the inner city as well. I'm a Denver native, born and raised, and grew up in generational poverty. So I too understand what our community is going through these trying times. I want to just mention how important it is during these trying times to have our community networks play that important role as we really try to work on our gap in services and really try to get our community the services they need. And so as we work today in trying to connect all of the dots here with our community partners that are presenting today, I think it's important to just discuss what we did back in March, and I'll talk about that here momentarily. And then Christian Maddie is going to go into the details about what we did in our Family and Adult Assistance Division and in our Child Support Services Division as well. I want to go backwards, as Dawn had mentioned, back to those days in March. In that moment of uncertainty. In our Family Adult Assistance Division, that's the division that I oversee. We have approximately 432 staff, and they are primarily responsible for all of the public assistance benefits, including our child care assistance, our medical assistance, our SNAP benefits, all of our adult and TANF assistance. So anything that has assistance, we're primarily responsible for administering and providing those benefits to our vulnerable community. At the time, back in March, when Dawn had to make that difficult decision of saying we had to close our doors, we had to deploy approximately 350 staff in a moment's notice, and that's not an easy feat to do. We had to deploy them home, and that means logistically we had to, get laptops, and in our Taylor office and in our East office, they did not have laptops, so we had to deploy desktops to their homes. And they were up and running in just less than 8 hours. And that's important for us because that meant that they were able to start working and processing cases so that we could continue benefits to our community, because that was important to us. We wanted to make sure that during that time, because we knew that the worst was yet to come, and for us, the worst was that the unemployment rates were coming, the increase in unemployment applications, and the surge in applications for SNAP benefits. And I know that Hunger Free is going to be showing that information here in their presentation momentarily. So as we start talking about what that means for our food and nutrition access points, we really want to hear from you of how can we start working together as a community. And we do consider human services, as our safety net, as part of the community. So as we start talking about getting feedback, as Mr. Mades mentioned, we really want to hear from you. What are things that we're doing well, but more importantly, where are those gaps, and how can we continue to fill those gaps, especially in the benefits area? We know that we are working very hard to fill those gaps. I want to just mention one of the things that we really worked hard during the pandemic and was to fill the call center need. When we shut down our lobbies, we cross-trained our lobby staff because our lobbies were closed, and we shifted all of those resources to our call center. So that allowed us to really shift resources into our call center so that we could really add some additional staff there, and that helped us with our wait times. And just to give you some additional metrics there, We were at wait times of over 20 minutes at times, and we've reduced that down to 8 minutes here in the last month of June. So that's phenomenal for us, because that means our customers are having to wait less. And as Dawn mentioned, when we're looking at the Bridges Out of Poverty lens, that for us is important, because our customers are not having to wait as long to get the services that they need. That's critical for us. So I'll pause there to see if we have any questions in the chat room. And then, yes.
Sorry about that. Yes, thank you for that, Lorraine. We do have a couple questions here. So first question for either yourself or Dawn. Laura states DHS staff has done an amazing job as they transition back to work and the state loses waivers and RRRs come back. What can we expect turnaround times to be for new applications?
That's a great question. So right now we are still working our applications same day or next day. So that's great for our customers that are applying for SNAP benefits. Our recertifications, we still have our staff working close to same day. So we're either same day or 48 hours within our recertifications. As many of you, and Christian will go into the details here momentarily, we did lose our waivers related to SNAP recertifications, and so that was unfortunate. That went away June 30th. And so we're still having to process those beginning July 1st. We are about 48 hours on those. However, we do expect those delays to increase as the workload increases here in the next upcoming months. So we'll keep everybody abreast of that as we continue these community partnership meetings. And I think to Dawn's point, we want to hear feedback on how that should be communicated.
All right, thank you for that. We have another question here. It looks like someone is also asking for more information regarding Head Start during during intakes and how that'll work.
Chris, I'm sorry, could they be a little more specific on that?
Yeah,
question?
We could ask a little more, yes. If whomever asked that question, if they wouldn't mind giving us a little, oh, here we go. I apologize, guys. They're asking, where are the gaps in reaching community members who may not be aware of the benefits available to them?
Maybe I'll take a stab at that first, which is, in some way, maybe my question back at is, where do you see the gaps so that we know where to go? That's certainly would be really helpful if everybody on this call could get on this chat and say, here's where I see a gap. Then that would allow us and our communications team and our benefits team to really say, okay, we heard 10 times there's this particular gap. I would say one area that we know that we struggle with is that a lot of the people we serve, they don't have the kind of access to, social media or whatever that a lot of us do. And so we may post things on, Facebook or who knows what, and there's a good chance they're not getting it. So we're really being thoughtful about where it is that we can, for lack of a better word, advertise our services to this population. And we serve, as I keep saying, 1 out of every 3. There's 240,000 people or so that we serve. How do we make sure that they hear about it? And I'm all ears. If we need to advertise during a Rockies game or on Que Bueno or something, whatever it is people think we should be doing, I'm all ears.
That's perfect. Thank you, Don. It looks like we do have 2 more questions here that we can address. The first one is do we have an idea of when our outreach workers will be back with our community partners, or how that'll look like, or excuse me, how that will look in the future?
That's a good question. I assume we're referring to our core, our community outreach kind of group that we have had people stationed in those nonprofits. I haven't talked to Dana Niemela, who leads that group, about what her thinking is about getting folks back in that setting. A part of it might be that we need to hear from our partners about whether they're having people come in their particular locations and therefore need us to be there as well. So why don't we put down as a to-do to follow up with Dana to see how she's doing outreach to you all, particularly I think we're up to almost 30 nonprofit partners where we have folks in those stations, so that we can make sure that we're in line with what your plans are. So I'll do that.
Okay, and next question. This one is for Lorraine. Looks like there's some information in the community that RRRs have been extended through December of 2020. Is this is or not accurate?
Before you answer, Lorraine, would you mind saying what an RRR is for everybody?
Absolutely, yeah. So for those of you that are not aware with our acronyms, an RRR is reapplication, recertification, or reexamination. So that's when a customer has to complete their time to reapply for benefits, and those are completed at intervals of either 6 months, 12 months, or 24 months for SNAP benefits. And so having said that, there are, I'm making the assumption that this is in reference to SNAP benefits, and there was thought that this was going to be a federal waiver through December. However, that was not the case. Our state partners at the Department of Human Services received the news that our waiver was not granted beyond June 30th. I will say for the medical assistance side, we have received some preliminary news that the public health emergency waiver that they had applied for, well, we're currently operating under a public health emergency waiver for medical assistance, and that waiver has tentatively been approved through October the 23rd preliminarily. So that is great news in that currently all of our medical assistance participants, they're receiving and will continue to receive, they're locked in for medical assistance through October. So those will continue through October 23rd, which is great news for the 111, I believe we're up to right now, Dawn. I don't want to quote that. I'll give you the exact numbers, and Christopher can send this out in a follow-up email as to the exact numbers Denver currently has receiving on medical assistance. It's a little over 100,000, but we have that exact count that are currently receiving Health First Medicaid assistance in Denver. But that will certainly help out for this trying time, especially during the pandemic, because they need to get their medical needs met.
Awesome, thank you, Lorraine. So we do have a couple follow-ups here from earlier questions. It looks like we did receive a response from Dana, Dawn.
Oh.
Dana states that we are allowing team members to return to sites as they open, provided appropriate safety protocols are being put into place. We will work with each individual site to provide any support we can to reach out to our customers.
Great.
And then regarding that Head Start question, they're asking, Lorraine, can information about Head Start be shared at the time of intake? Only a couple of the delegates are currently represented in the system.
Yes, absolutely. We are more than welcome to share that information at the interview. I'm more than happy to share that. I know that we are sharing that at the time of the Child Care Assistance Program interview that's required. So we can certainly do that for the other interviews. We can certainly work with our Head Start partners We have several within the city, so we can certainly do that. We can connect with those partners and receive that information.
Perfect. Thank you so much.
Thank
So
you.
what we're going to do, we're going to move forward with our first presenter.
Well, Chris, can I semi-rudely interrupt? I apologize because I do need to sign off. But I wanted to close with one thing that I did see in the chat that we didn't talk about. Just give me 30 seconds, which is, what is our plan? So just generally, we're looking at keeping our current sort of mode of operating until Labor Day, although we are going to start on an appointment-only basis, start having people come in who made EBT cards and things like that. So we are looking at some of that kind of reopening. But after Labor Day is sort of the big question, is what it's going to look like. You know, I really am pondering, you know, what do we just unlock the doors and let everybody come in like we used to? And I just think that the answer is no. But again, if you would all comment on that, what if we were to keep a sort of a generally not have a bunch of people show up in our lobby, how will that impact the people you serve? What should we do in our lobby? And if it's open everything up, and that's the only way we can really get to people, then amen, we'll look at that. But the bottom line is we're sort of continuing to do status quo-ish with some slight services being offered in person at Castro until Labor Day. And then after Labor Day, we're looking at what do we do with East, what do we do with Mount Bello and Taylor, and what do we do more at Castro. So I wanted to just kind of address that, Chris, before I sign off. And thank you all so very much for all you're doing and for giving us your feedback.
That's no problem, Don. Thank you so much. And yes, as he said, please continue to provide comments, feedback, questions, and what we'll do is actually take all of these at the end, kind of process them through, get them to who would be best to answer, and make sure we'll send out a follow-up email to all presenters with the remaining questions answered. So no worries there. Keep them coming.
Thanks, Bill.
All right. So next up, we're actually going to have Bryn Daly come on to speak about the hashtag BeAGiver School Supply Drive.
Thank you, Chris. Thank you all for having me again. I hope you all are well. I hope there is a day soon that we can all meet safely. And just wanted to say that I do miss these community network meetings. So now we are in the midst of Denver Human Services hashtag BeAGiver School Supply Drive. Throughout the month of July, DHS holds our annual school supply drive to support K through 12 students in need that are served across DHS programs and divisions. We do this so that they can start the school year on the right track and have confidence that they are prepared for a successful school year ahead. There are 3 ways to hashtag BeAGiver and support our students and families in need this year. They're on the next slide. So the first way here is adopting or sponsoring a student. Caseworkers from our child welfare and foster care programs, child welfare programs, including foster care and child protection, nominate students on their caseload that are in need, and community members can sign up to be matched with a specific student or students and support their specific schooling and get supplies specifically just for them. Linked under number 1, the underlined adopt a student is a link to our registration form that has more details about that aspect of the drive this year. Number 2 here is folks can donate general school supplies to support students across all DHS programs. This year, there are not physical drop-off locations for general school supplies. Instead, they can all be sent directly to DHS, the Castro building. Linked and number 2 there, under donate school supplies, is our document with most needed supplies for every school age group, as well as links to our Amazon and Walmart wish lists that allow community members to have their contributions sent directly and without contact to DHS and to our students. And lastly, folks could make a monetary donation and let us do the shopping for you. To donate this year, folks can send a check directly to DHS, and the link in number 3 has more details on how and where to send a check. Folks can also make credit card donations now. We were able to work with our IT team to get that back up and running. And that link for a credit card donation is at denvergov.org/give. In fact, all of this information and all of these links can also all be found at denvergov.org/give. The next slide is my contact information for any questions anybody has. Thank you so much for your consideration and support for our students during this unprecedented time. I do want to quickly mention, I had forgotten, along with school supplies this year, we are also hoping to give out as many headphones and earbuds as we can to students to support virtual learning as it continues in the fall across schools, however their plans may be. So yes, definitely wanted to mention that as well. Thank you all again.
Thank you, Bryn. We appreciate that. All right. So next up, we have Christian Maddie.
Thank you, Chris. I just want to make sure, can everybody hear me okay? Just a thumbs up or a head shake. Thank you. All right, fantastic. So like Chris said, I'm Christian Maddie. I'm the Deputy Division Director with the Child Support Services and Family and Adult Assistance Division. And yes, you heard that right. I work in 2 divisions, and I think this is just a testament to how committed Human Services now is to breaking down our internal silos. So I've lost a little bit of hair learning the new program, which is the Assistance Division, but it's been really great, a really great experience. Next slide, please. So I think it's important to kind of frame this conversation within the Human Services, Human Together goal framework. So I just wanted to say, without going through this entirely, for those that aren't familiar with it, my definitions are really essential services are kind of the stuff that we have to do. Network of opportunity is kind of Human Services connecting with inside our organization to make sure that we can identify core problems and kind of provide wraparound services. And really, the healthy and connected community sphere here is really where I think this conversation is. It's us getting outside of our building to make a difference in the community, and we certainly appreciate all of our partners in doing that. Next slide, please. So here are the goals that we have, and again, for those that aren't familiar with it, we have equity and access, safety and wellness, connectivity, economic resilience, and the DHS workforce that we are focusing on. And I would definitely frame this within the equity and access, in that we just want to make sure that and really, I had a really good example of this for me once. It was 3 people trying to watch a baseball game over a fence, right? And there's a shorter person, a medium-sized person, and a taller person. And for me, equity really means that if you're shorter, you get more boxes so that you can see over the fence. If everybody gets the same size box, some people still can't see over the fence. And so, you know, in the situation that we're in now, it's really highlighting this. We need to be equitable. And I'll go into that a little bit in the future slides. Next slide, please. All right, so today's topics are going to be the waivers and procedural changes that we are experiencing in the FAD division, Family and Adult Assistance Division. We want to talk about electronic benefit cards. We want to talk about how to apply for services with the building closed. And yes, there's a computer there, and I think a lot of people are thinking right now, what if you don't have a computer? And so I wanted to also talk about the document runner program that we started at the beginning of the crisis. Next slide, please. All right, so as far as waivers and procedural changes, when I'm talking about waivers, I'm really talking about, in our program, we have quite a few federally mandated steps. It's stuff that we have to do. We have to check the boxes on certain things. But in kind of a crisis situation, we can be given permission to skip certain steps because of what the current situation is. So that's what I'm talking about when I'm talking about waivers. When I'm talking about procedural changes, it's really just things inside within our own sphere of control that we've kind of tweaked or adjusted or changed to make sure that we can respond to what the current situation is as well. I've highlighted some of the topics that are specific to the Supplemental Nutrition Assistance Program. I hope that's the most recent logo. It's the one I found on the internet, so we're going to go with it. But I think Lorraine already alluded to one of our waivers has expired. And what this was a waiver for during the application and recertification process in SNAP to waive the interview. So really what this means is that customers have to complete a telephonic interview now in order to receive and continue to receive benefits. And for us, this really represents kind of a back to, I got to use the air quotes, this is kind of a back to normal situation for us, but it's not face to face. We are gearing up now to kind of respond to the change in that process to make sure that we have enough personnel ready to conduct those interviews. The next thing that's coming up is there was an emergency allotment connected to SNAP, which basically, and Lorraine is the expert on this and can probably get more information about amounts and the specific circumstances. But this emergency allotment allowed a household to get up to the maximum benefit. That waiver or that emergency allotment will be ending on the 31st. And so we talked about how do we get the message out, and we may need a lot of help getting that out because that may catch some folks a little off guard. We do have a waiver that continues to be in place in a couple of our programs, and this is in the Adult Financial and Colorado Works, also known as TANF programs. The waiver continues indefinitely, and what this is an automatic recertification, which really just means that you don't have to take any really kind of action or talk to us to continue to receive benefits. So that's kind of the high level waiver side. With our doors closed, we are definitely not taking lobby visits as staff are working from home, but we are available by phone through our call center. And we also have this really cool phone system called Jabber, which really allows a person to have their laptop or desktop at home kind of just usurp their desktop phone and kind of take over. So it really allows us to do a lot of business from home. And as Lorraine said, we kind of pulled that off in 8 hours, which was pretty fantastic. Next slide, please. So I wanted to talk about EBT cards. So as Don alluded to, we are talking about what the possibilities are in the future. I don't want to go too much into detail because I don't want to get away from too much of what we're doing right now, but there have been a lot of discussions. As far as it is right now, all cards are priority mailed to the customer through the mail. So that kind of begs the question, what happens if somebody does not have a home to mail it to? So for the homeless population, cards are mailed to shelters, and it really is of their choice. So it can be any shelter within kind of our sphere of influence, but we default to the St. Francis shelter as a place where that card can be received. Emergency situations are kind of handled case by case. We are seeing some people show up on our front porch. We are not sending people away who have, really critical circumstances. We do try to assist as much as possible. With that said, we could use some help kind of managing that, and that the word gets out that, we really need to mail it, or if you're in a homeless situation, we can mail it to one of the shelters, because one of our big worries is that we have a line kind of around our building trying to get EBT cards before we're really prepared for that. So we could definitely use help for that. Next slide, please. So how to apply for services. So yes, I have the little computer icon. These are all the links to all of the benefits and services that we apply through the electronic application process. So we definitely have our call center open. This is the 720-944-4DHS or 4347. The Colorado Peak application is of course available online. LEAP, there's always, and Lorraine can help me out with this one, but there's always kind of a softness to when LEAP ends. So I don't know what the exact status is right now, but if that's something somebody needs to know, I can definitely get that information. And Chris, are you raising your hand because you know the answer? Okay, no scratching, got it. And I'd also like to encourage anybody who is a homeowner within the city to consider applying for the Denver Property Tax Relief Program. Link is there. I think this is something that could help a lot of people, especially given the current circumstances. So as much as we can get the word out on that one, we would really appreciate it. Next slide, please. Okay, so while we're closed, I also wanted to talk about the child support division, because that's kind of where I come from, so I couldn't help but sneak it in. We have somewhat of a waiver in that we are allowed to process applications with telephonic signature. So I would actually encourage anybody to just call 720-944-2960 or the 4DHS number to get through to our child support folks. This is kind of unprecedented for us in that child support has always required wet signatures on everything. So given the opportunity to make things easier on people, we'd really like to take advantage of it. So if they call us, we will definitely process that without necessarily having a paper application changing hands. Of course, I also have to mention that our child welfare section is very much up and running. They can be called 24 hours a day, 844 Colorado for Kids. While the building is closed, we are very much in the business of helping people that are in need and protecting those that are in harm's way. So I know that having our doors closed and most people generally being used to interacting with us in person is a detriment, but we're very much in the business of helping people right now. So I just wanted to stress that. Next slide, please. All right, so for all of you that have that question, okay, you've told us, Christian, the only way that we can really apply is online. And if that's the impression that you got, that was not my intent. So there is still a way to apply if you don't have access to the internet or easy transportation to get to our building. I have a great spiel on this, but I don't think I can do a better job than Mona. So Mona is one of our original document runners when the program first came in play, and I really think she's got the best description of what's going on. So if you could play that for me, Chris, I'd really appreciate it. And it sounds like we might have an issue with the sound.
Yeah, I apologize to everyone. I am losing my network connection and no longer can share my audio. So give us just a quick moment. We might be able to find a different way to do this. And
okay, so while you're doing that, I'm going to just talk about it. So what Mona is saying is, basically when this crisis first hit, we really had to come together and think about, if people don't have access to our building, what the heck are we going to do? What about people that don't have good access to the internet? And so when I'm talking about that, I'm talking about cricket phones or just have limited connectivity to the internet. And while I can interact with Facebook and Twitter, filling out an application isn't really reasonable, and will probably use up all my minutes. And also, what if I just don't have access to the internet? What if this isn't a part of how I operate? So we had to really think hard about how do we do this. So what we developed is a program where you can actually call us, and the number is 720-944-1520, which is somewhere in this video. What you can do is call this number and say, look, I just don't have access to the internet and I need to apply for SNAP or child support or Colorado Works. Would you please just come bring me an application and drop it off on my doorstep? So we developed the program where we're very much like DoorDash, right? So we kind of, we know where we're going. We get the information, we run to the location in one of our DHS vehicles or one of the personal vehicles. We drop off the application and we run because we don't want there to be any contact. But we'll call the client and say, hey, we've just dropped off your application. Well, you know, it's under your doormat or it's in your mailbox or wherever it is that you asked me to put it. The packet includes the application and a self-addressed postage paid envelope, which a person can use to mail it back to us, or if that's really not practical, and we're finding this happens a lot in the case where people are kind of fragile and getting outside the building and getting to a mailbox isn't very practical. We'll actually, upon their request, call the same number, say, can you come pick up my application? We'll come to your location, pick it up, take it back to the office, and it gets processed along with all the other applications that were received. So when I talk about equity and access, I'm talking about folks are on the same footing as close as possible to somebody that has internet access if they don't have it. We will go the extra mile in order to make sure that the person that hits send on their computer is on equal footing with the person that needs has no internet and needs us to come pick it up. And so we're really proud of it. And as much as you can help us advertise this, we would love the support.
Christian, I think we have a way to share it through one of our producers. So
okay, you want to give it a shot?
Take it away and see what we can do.
Alrighty. Well, that's a bummer. So, you know, me, I like to test the boundaries on all technology and push things as far as I possibly can. Apologize, we don't have the video, but it is available if you'd like to watch it on the department's Facebook page. So I invite anybody to watch it. I think Mona's fantastic. She does a really good job. Every time I get it, I watch it, I get a little sand in my eye. Because just watching her run around the city, especially on a hot day like today, just I really admire the folks that are doing this and their dedication to helping people in need.
Yeah, and it looks like the link to the video is actually in the chat. So anyone that is attending right now, feel free to click on that and watch it when we're complete, or save it for later.
Thanks, Chris. I think we can go to the next slide. All right, so I thought I'd share a little bit of the metrics of what this looks like. So pie chart on the right side is really talking about what are folks asking for. And what we're finding in the gigantic orange slice is people are really asking for the single purpose application, which connects to many of the benefits in the assistance division, things like Colorado Works, Medicaid, adult financial, SNAP. That's kind of our biggest request. The blue slice there is really we're finding we're getting some child support applications requested for. I have a theory in this pandemic that you know, it may be actually increasing the need for child support. I read an article the other day that talking about how some relationships are being strained during this pandemic, and we might actually see something along the lines of a second baby boom. So child support's gearing up to be ready for that. With that said, we're prepared for whichever direction that might go in. The chart below, it's just kind of showing what the volume looks like. This is as of the middle of last month. We've actually seen a bit of a surge recently. We're also exploring some of the other things that people would need. So if you look at the green slice up at the top, it's kind of a small sliver, but we've been finding that people are asking for documents related to applying for supplemental social income. We had a person come from way out of town and say, you know, I'm desperately trying to get the results of my genetic test out of child support because I need it to process benefits. So we were able to run that. Again, any help that you can give us in advertising this would be appreciated. But I just want to say we're really proud that we're doing this. Next slide, please. Okay, so because I'm kind of a map nerd, and because I had the data, we actually took some time to create a heat map of where people are really asking for our services in both, for the document runner program, in both pickups and drop-offs. And I think most people in our field are somewhat familiar with the concept of the inverted L, which is that area of high density that kind of goes up from Inglewood up to Wheat Ridge, and then it kind of hooks a right and then starts heading towards the airport and all the way out to kind of Pena Boulevard. So if you're saying that this to me represents the inverted L. This is where our catchment area is. This is where we get most of our clients from. So that part didn't surprise me, but what did surprise me is when I'm starting to see the representation kind of in the hook of the L, kind of in that area that says Buckley Air Force Base, but I know it's closed. But in that area there, that kind of fuzzy spot in the middle, this was a little bit of a surprise in that it's not traditionally where we get most of our cases from, but I think it just may be a sign of the times that like it's starting to affect everybody. So we're definitely paying attention to that. Okay, so I talk really fast and I find that most child support people do, but I wanted to take the next 8 minutes or so to see if I can answer any questions out of the chat, or if there's anything anybody's curious about, any suggestions, any feedback that you would want to give us.
All right, so looks like, Christian, we have a question. Someone asked, can you send the data of the document runner? What neighborhoods are asking?
I can. I'd be happy to share that heat map, and I think I can get down to at least zip code, if that would be helpful.
Awesome, and I am seeing a couple just general questions about this presentation being sent. This is being recorded, just to reiterate, and we'll be able to send this out to whomever needs it at that time.
Okay, so I also just want to say that that is my desk number and my cell number. Please feel free to call me. I probably won't answer at 11 o'clock at night, but I am dedicated to helping, and I've come to realize that I didn't spend much time talking about me at the beginning of this because I wanted to make sure I saved time for everybody else in this presentation, and as you can tell, I talk a lot. But I just wanted to say, so my background is I have been in human services for 18 years, I think just as of a few days ago, primarily in child support, but I know enough about assistance programs to be dangerous. So if I can't answer your question, I may have to call a lifeline, which is probably going to be Lorraine, because man, does she know a lot. Before that, I spent about 9 years in the Army Judge Advocate General's course, and I think that's where it gives me my dedicated drive-through, get things done attitude from. But before that, I was also a foster care in the I was foster kid in foster care in the West Virginia Department of Social Services at the time. So I think that is what really affected my life and makes me want to be a public servant. So with that said, please email me, call me if you need anything. I will do my best to get you whatever information that it is that you need, because that's kind of what we are about. So thank you.
Yep, we have one more question. I apologize. We'll finish
No
this
problem.
up. Someone mentioned, or excuse me, you mentioned equity. What is being done as a department, and specifically within the Child Welfare Division, to address the disproportionate number of Black and other people of color who are involved in the system, and addressing the potential biases of staff?
I think that is an excellent question, and I will say that is a bit out of my range of knowledge. With that said, if you want to contact me directly, I do have some good contacts in the child welfare system at the deputy level and above. I'd be happy to forward your question. I know they've been talking about this, and I know, given recent events, it's something they're paying a lot of attention to. And one of the things that I know that they have in the child welfare system is excellent metrics. So there is the ability to analyze this. But because I am mostly on the assistance side and child support side, I don't want to weigh into that question without getting a subject matter expert to connect with you.
Sounds good. Thank you, Christian. And I did want to say that that with that question and others, we do take these issues very seriously. And there's been a number of initiatives underway, including partnering with the Mayor's Office of Equity and Social Innovation. And if anyone has additional questions regarding that, they can email our DHS News and we can connect them to division leadership for specifics. So I just wanted to get that information out there as well. All right, with that, I think we're going to move on to our next presenter. And I have Brett Reeder come on up.
Well, thanks so much. We really appreciate being a part of this conversation. And early on, there was some discussion around what DHS had to do in order to go full remote. And I have the pleasure of working with all 64 counties. And counties can be big ships to turn. And I can say we're pretty impressed with the speed at which Denver, in particular, made that pivot. So thank you to the DHS friends on the call here. Chris, let's go ahead and just move to the first slide with text. So the next one. Thank you. So I'm Brett Reeder, Director of Client Services for Hunger Free Colorado. And that's really what's in blue here, the direct service portion of our work, which is about connecting people in need to available food resources. Hunger Free as an organization, in addition to that direct service work, does a lot of policy work as well as some sort of cultural work. So we have projects like Hunger Through My Lens, which is meant to provide a platform for people with lived experience to tell their story. What does it mean to be hungry, and what does it feel like and look like to go through the various systems we have that try to address hunger. Ultimately, at Hunger Free, we believe that hunger is a solvable problem. There's a lot of problems out there that probably won't be solved in my lifetime, but hunger we don't believe has to be one of those. That there's enough food, at least in this country, and it's just not always getting to everybody who needs it. So that's why we exist, is to get closer to a future where all Coloradans have enough to eat of culturally appropriate and nutritious food to thrive. And I'm going to talk mostly today, though, about that the direct service role that we play. So if you go to the next slide, please. Okay, so when I say connect people in need to food resources, there's a lot of food resources out there, but it's sort of complicated and hard to understand. And so this just is really kind of pulling out. This isn't even comprehensive, but there's sort of at least 3 big buckets of resources out there. One is directly providing food. So that's often what we call the emergency food system. And my friend, Chris, is going to talk more about that with FBR, Food Bank of the Rockies. There's also soup kitchens, pantries, and if you're not familiar with the distinction between some of these, food banks like FBR and the other 5 large food banks in the Colorado emergency food system warehouse food and provide it out to pantries. Often they have their own pantries as well. The pantries are where you're picking up food. It's like the retail side of the emergency food system. And soup kitchens are where folks are getting a hot meal on site. There's a variety of other programs, of course, free and reduced lunch, summer food service, CSFP, Meals on Wheels, Hungry Meals. So all in the sort of emergency food space where someone's hungry, needs food right now, and here's some food. And then there's the bucket that is, it's not really money, as it says there, it's more like in kind, but you can think of it as money. It's like benefits to get food, SNAP and WIC being among those. And then there's also food education programs out there like Cooking Matters and SNAP Ed, which attempt to not only help folks learn how to cook nutritious meals, but to do it on a budget. So there's all of these resources out there, and part of our direct service role is to connect people to those resources. One of the things we do is SNAP application assistance. So we have telephonic signature capability. So folks who call in to our hotline or are referred to us and we reach out to, if they're eligible and interested, we're actually able to take them all the way through application and do a telephonic signature on their behalf, and then the application is processed. So really our role is to ensure that folks in need are connected to these available resources. So if you go to the next slide, please. But there's some barriers between the need and the resources. And those often fall within these sort of three big buckets. One is awareness and knowledge. So just knowing that the resources are out there. That previous slide had a lot of resources, and most people aren't aware of all of them. Some aren't aware of any of them. And then also just a lack of information on how to apply. So you know what's out there. How do you actually go about applying for those resources out there? And then sometimes there's some misinformation out in the community about eligibility rules. So sometimes we'll hear things on our hotline like, well, I'm working, so I'm not eligible for SNAP, which is almost backwards. It's and so a lot of times part of our role is just kind of myth busting that misinformation. And then confusing communications. So there's a lot of organizations that play in this space. And so folks are getting information from departments of health, departments of human services, nonprofit organizations like ours, all different sorts of places. And really, when you're hungry, it can be difficult to sort of understand the difference between, well, WIC is in CDPHE and SNAP is in CDHS, and ultimately they're both run through our local government entities, whether it's the local public health entity or the human services entity, as Denver Human Services is. And so there can be a lot of different sort of communications that it can be confusing. And then on the far right there, the ability and systems. So, a lot of folks working on making these application processes less cumbersome, but they're generally more cumbersome than I think we would like. And a lot of that has to do with federal regulations. But the effort to get through an application is sometimes more than we'd like. Transportation mobility challenges. So this is true even pre-COVID. A lot of folks who are in need of food often have transportation challenges as well. And then in the COVID world, that looks even more difficult for many folks. And then sometimes look at that bottom bullet there. The times, whether it's my team or a county team, the times we're available as a system don't always work for everyone. And so that can be a challenge as well. And then there's this desire fear sort of bucket in the middle there. Some of that is related to stigma. So the process of application and receiving benefits can sometimes have stigma related to it. And there's also, for many folks, particularly in immigrant communities, some fear around how participation could impact their status, and some misinformation often around that. And then in some cases, just a sense that benefit levels are too low to warrant participation. So just that sort of cost benefit of I have to jump through all these hoops to get the benefit, and it's not big enough to do that. We actually find at Hunger Free that a lot of times that's more related to misinformation around what the benefit will be. So just SNAP as an example, the minimum benefit is $16 a month, but most people get several $100s per month. And so sometimes there'll be the message out there that, oh, you're only going to get 16 bucks, it's not worth it. But for that individual, it's or that family, it's substantially more. So ultimately, in our direct service role, we're trying to connect people to those resources from the previous slide and help overcome these barriers on this slide. So next slide, please. So for Hunger Free, there's a variety of organizations that do this, but Hunger Free has three ways that we go about trying to connect people to resources. One is our hotline and referrals. So we have a toll-free number that folks can cold call, but we also get referrals from, it's actually more than 41 community partners at the moment, but community partners across the state. So that's hospitals, clinics, some other nonprofit organizations, in some cases counties. But we take referrals, and then our what we call food assistance navigators will proactively outreach to those folks. And we are bilingual statewide. And really the food assistance navigator's role is that it's navigation, navigating these systems, including SNAP and SNAP applications. So for folks where that's a relevant resource, part of their role is to ensure that folks get all the way through application, and then we actually follow up with that individual to help them ensure that you know, they understand the verifications they're going to need and all that sort of thing. Mobile outreach is in normal times a big part of our work as well. It looks a little bit different at the moment, but that's where we're doing the same work on site at various partner sites. And you know, as I think is true for most organizations right now, big part of what we're thinking about is what are the criteria to say that it's safe to now go back into the community. And I think we're struggling with that along with most of you and most of the system. And then finally, we have SNAP Keys, which is partners engaging in application. It's actually Keys application services. But what that is a partnership we have with variety of organizations across the state where they can do this work too. So they do the same kind of thing, help folks get connected to food resources, including SNAP application assistance. And in Denver, we've got Denver Housing Authority, Denver Indian Family Resource Center, Dr. Cog, and Mile High United Way as partners. So all of those four agencies do the same kind of work I was just talking about. And our role there is sort of empowering them to be able to do that. So providing some of the training, technical assistance, and actually in some cases funding. So there's federal funding available for this work at a 50-50 match. And we help organizations that are interested and able to do this work get some funding to support that as well. So next slide, please. Where are we with SNAP Keys? Most of the state here in dark green, 33 partners at the moment in 53 counties. Go ahead to the next slide. And there's a variety of entity types. So WIC clinics, DHS offices, food banks, pantries, medical clinics, other nonprofit organizations. We have a partnership with the Family Resource Center Association, so family resource centers across the state. But really the idea is a lot of these types of organizations are already in contact with folks that are likely eligible for SNAP, but not enrolled. And so just adding on that SNAP application assistance, as well as the general food system navigation to work they're already doing. Next slide, please. And so this has been true throughout, but as everybody's acutely aware, COVID-19 has had a major impact on all of our lives. One of the most important, in our view, is the effect it's had on employment as folks lose jobs. Of course, the risk for food insecurity, as well as all these other things that we care about, goes up. And I think most people are probably aware that the unemployment rate right now is at sort of unprecedented levels. So you see that huge spike. This is Colorado's unemployment rate. Huge spike in April, dropped a bit in May, and nationally dropped a bit again in June. Don't have the Colorado numbers yet, but should be soon. What we don't know is sort of where this is going to bottom out, and then how deep it'll go and how long it'll go. But we do know that as poverty increases, as folks lose jobs, that the work we do collectively as a system is ever more important. So next slide, please. And this is a picture of we at Hunger Free, what we saw when COVID hit. So what you see there, the bars are the daily call volume, and the line there is a rolling 5-day average. And you see that, you know, we're kind of stable there in February, and then mid-March just skyrockets. And our call volume peaked at 4 times the daily average initially, and then we've seen it drop to a couple plateaus and kind of stabilize right around 2 times pre-COVID. So one of the takeaways for us in this context has been not only that the need increases, but that it's sort of punctuated. It'll jump and spike with various things. So we saw right as the stay-at-home order went into place, like that day, we started seeing increased calls, and it really went up and up and up every day following that until it kind of peaked, and then came back down a little bit and has stabilized, as I said, about 2 times pre-COVID. So next slide, please. The other thing for us all to keep in mind is, and no surprise to anyone, but the pandemic's active. So a ton of uncertainty. One of the things we do know, though, is in Colorado, we sort of plateaued with the stay-at-home, started dropping a bit, and then when we opened up again, we're starting to tick up. And the truth is, none of us really know where this is going, but what we do know is that it's unlikely to be over soon. That whatever this looks like is going to be a thing we deal with as a system, as a community, as a society for some time to come. Next slide, please. The other thing we know is that the sort of federal interventions and local interventions were meant to be time limited. So sometimes you'll hear put the economy in a medically induced coma was sort of the idea of the CARES Act, but a lot of the interventions so far were meant to get us through a period of time, and so are starting to sunset. And some of that we talked about earlier in the presentation. So there's some waivers, the recertification extension, interview waivers for SNAP have sunset now. Paycheck protection program that's businesses that could turn into grants. But that's really over at this point. There's some regulation easements, we'll say, with the eviction and utility moratorium. So some of the stuff is already hit, and we're starting to see it on our hotline. We're starting to hear people who had been okay, say, with not being evicted, starting to worry about that. It's been picking up quite a bit in the last few days. And so as we hit these cliffs, we anticipate that we'll see more punctuations. So another couple big ones here are the max benefit allotment. So that's where in SNAP folks, SNAP benefits are adjusted based on your income and family size, but there's a maximum you can get. And during the emergency, folks were getting the maximum. As of right now, anyway, that's going away in into the month. Now it's possible that it'll actually get extended because of POLIS's extended emergency declaration. The state can ask for that waiver again, but as of today, it ends end of the month. Another big one that many of you are probably aware of is the additional $600 per week for unemployment. That ends in this month as well. And then EBT, which I'll talk a little bit about later on, is a one-time payment for folks with children that were eligible for free and reduced lunch. Great thing. It's also a one-time payment though. So what I'm trying to call out here is that a lot of these interventions that have gotten us through are starting to fall away. And as they do, we should expect the need to increase. A couple others just to call out here. Some of the WIC waivers are now extended through the end of September. So that's like the physical presence waiver, which means you don't have to physically be present for some of the equivalent of like an interview for them. And then there's also a couple extensions of unemployment that end into the year. And so that's related to the extension and amount of time you can be on unemployment, as well as certain folks who weren't typically eligible for unemployment, like gig workers being eligible for PUC or pandemic unemployment compensation. So a lot of great programs that really intended for a short-term emergency, and as those start to fall away, I think we as a system will see increased need. Let's go to the next one, please. Okay, so how to get involved. For getting involved with Hunger Free, there's a few ways to refer folks to us. if that's the best way to serve your population. And again, if someone's referred to us, then one of our food assistance navigators reaches out to that individual, or if the school call, talks to them immediately and gets them connected to all the relevant food resources for that individual and family, including SNAP application assistance if that's relevant. So a couple ways to do that. There's two referral forms for us. One is really organizationally focused, so it's for folks who work with someone who might be eligible in order to refer to us. And then there's a client-facing referral form for folks to self-refer. And so both those links are there. And then also our toll-free hotline number is there as well. And we answer phones live 8 to 4:30, but we also take voicemails and return voicemails typically same day, unless it's later in the day, which would be the following day. There have been times where that extends. So when you saw that huge spike where we're getting 4 times the typical calls, it was more like a few days. But right now we're returning calls typically the same day. And we can also talk about posting a mobile outreach site. We're not currently in the field, so we're not currently doing that. But as folks begin to open up, we can always do that as well. So that's where we'd send one of our navigators actually physically to location and do the same kind of work, but face-to-face interact with folks. And then the last is becoming the SNAP Keys site. So we can also talk about empowering your organization to do this work yourself. In general, that really is only worth it if you're an entity that sees a lot of new folks, so there's turnover, as opposed to like the same folks over and over. For that, usually it makes more sense to just send one of our folks out there to sign people up who are eligible and interested. But if you do see a lot of folks who tend to fall into that eligible not enrolled bucket and want to do some of that work yourself, then we'd love to help you do that. That's part of our role as well. Next slide, please. So this is just visually what that organizational referral form looks like. There aren't a whole lot of questions that are required, but you hop on in there, web-based, and so you do need an internet connection. But once that referral goes out to us, then we contact that individual based on their preferred method of contact. So that's email, text, phone, and it really depends on the person what they prefer. But we'll get back to them however makes the most sense to them, and then help them get connected to the food resources most relevant to them, including SNAP application assistance if that's what is appropriate. And so we have bilingual navigators, so we do that in your preferred language if it's English or Spanish, and if your preferred language is something other than English or Spanish, we can still help you out, but we have to use a translation service there. So it's not quite as customer friendly as we'd like, but we can still serve you in the language of your heart or your preferred language. So that in that case, what happens is using language line, it's translated back and forth. But if your preferred language is English or Spanish, then I would help you out in your preferred language. Next slide, please. Okay, PBT. So real quick, just wanted to make folks aware of PBT, which is related to, really as a policy, what it's meant to do is provide the funds that would have gone to free and reduced lunch meals in schools to families because the school was closed. And so what this looks like is a one-time payment of up to $279 per eligible child. So as long as you're eligible over the 3 months, which is March, April, May, you get that $279 per child. And this is for students who receive free and reduced price meals and attending schools that operate free and reduced price lunch program or have become eligible since then. So, but the trick here is that there's essentially 2 ways to get this. One is if you are on SNAP already and you received SNAP benefits in March, April, or May, then it actually just gets put right onto your EBT card. So no action necessary by the client, and that's for most folks. Folks who don't work on SNAP but have since become eligible need to apply on a landing page that is unfortunately not built yet, but should be mid to late July. And in that case, folks provide a bit of information for the application, and then would end up getting it's an EBT card that looks a little bit different. A couple things to note about this program. One is that it is a partnership with CDE because it's the Department of Education and the Colorado Department of Human Services. And so it will look like SNAP for a lot of folks, but it's actually a different program because this is related to the free and reduced lunch program. And then that website down there has a lot of information if you are interested in learning more about that. I'd also be happy to connect folks to further information about that sort of thing. For most folks, they'll just get it because the largest number are already on SNAP. The portion then that need to apply, the best way to do that is going to be to go onto this almost built but not quite built landing page. And then for folks where that doesn't work, where it's either a technology barrier or an internet barrier or something like that, Hunger Free is going to be helping those folks. And for folks where your primary language is something other than English and Spanish, so this will all be in both English and Spanish, but if it's something else, then Mahai United Way 211 will be helping those folks telephonically. So, but both agencies ask that you contact us first before referring folks to us, because we are talking about hundreds of thousands of individuals. And so it really does need to be that web application first, because neither one of our agencies is able to take on hundreds of thousands of calls right now. So what we want to do is ensure everybody who can do the application through the website do that first. And then for folks where that's not an option and is a barrier, that we provide the telephonic assistance through either agency for those folks. So I think I'm actually a little bit over time, but I will stop there. And I guess Chris can take questions now or later, depending on what you prefer.
Yep, well, actually, just for time, we will move on with Chris Taylor with Food Bank of the Rockies. We have some time allotted. At the end, we can address a couple of questions that have come up, so no problems at all. So with that, I'll bring on Chris Taylor.
Hi, good morning. Thumbs up, Chris, if you can hear me okay. Awesome, thanks a lot. So as the slide says, I'm Chris Taylor, Programs Outreach Manager with Food Bank of the Rockies. This is my contact information, which will also be at the end. I've been with the Food Bank of the Rockies for a little over 8 years, and this is a time I have never seen before in those 8 years. So I'm glad to be part of this group to share a little bit more about what we do and how we've impacted the city and county of Denver through these times. So next slide, please. I always like to start off with this information. Food Bank of the Rockies, we've been around since 1978, so celebrated 40 years a couple years ago. We serve 30 Colorado counties, so the upper half of the state, that's in yellow, as well as all 23 counties in the state of Wyoming. We've got 2 Denver-based warehouses. The one that I'm in is off of Havana and I-70. And then we've got our Nome Street warehouse, which is just a couple miles away from here, that houses our government programs. And then we have a warehouse in Palisade that serves our Western Slope communities. And our Wyoming warehouse is in Evansville, just kind of a part of Casper. Next slide. So we are working to end hunger through partnerships. So as Brett highlighted a bit, so we are a giant warehouse. So our warehouse that I'm in is over 100,000 square feet. We don't traditionally serve the public from this warehouse, but we work with hundreds and hundreds of partners across our 2-state service area. We work with nonprofits who host food pantries, soup kitchens, group homes, mental health centers, homeless shelters, and those organizations get food from us for their hunger relief programs to serve the public. We also have about 37 locations across Colorado for mobile pantries. And that's one of our only direct service programs where we actually bring a semi-truck out and hand out thousands of pounds of food, including the Emergency Food Assistance Program, TFAP food. And those are open to the public, no geographic requirements. So if you live in Denver, you can attend the mobile pantry in Adams County. There's no requirements there. And we do about 45 stops a month among those 37 locations. So some of them are twice a month. We also have our kids program. So we are a state sponsor for after-school meals as well as summer meals. Those look a little different right now with the waiver in place, which is a good thing. We're able to send meals home with kids. We are distributing fresh meals at a few of our mobile pantries. So as families line up in their cars for food, we ask them how many kids are in their household. And we're able to give them enough meals for each of their children, 18 and under, to have one extra meal a day. Additionally, we've got our Totes of Hope program, which is a weekend backpack program. We work with about 60 to 65 partners. Those could be schools, rec centers, libraries that are sending food home with kids, typically on Fridays, so that their families have some extra meals for the weekend. We've got 2 government programs that cater to families and adults, individuals that are low income. The Emergency Food Assistance Program, which is supplemental food that goes out to eligible individuals and families, as well as the CSFP Commodity Supplemental Food Program. We like to call it the free grocery box for older adults, which is anyone 60 or over who are also income eligible. And SNAP Outreach, we are a proud partner of Hunger Free Colorado. We are a SNAP-P, and we've got someone who does SNAP Outreach application assistance, mainly in our eastern rural communities, where we can be out at our mobile pantries typically. We have them on site here as well, so that they can do telephonic application assistance during this time where we're not able to kind of get in person with folks at our mobiles. But yeah, that's been a really great program that we just launched less than a year ago. So we're excited to continue that work in partnership with Hunger Free. Next slide. An additional program that has come to be during this time is our Farm to Families, which is also known as CFAP, Coronavirus Food Assistance Program. This program started in May, and it's expected to run through the end of this calendar year. To date, we have distributed over 4 million pounds of mainly fresh produce, plus milk and cooked frozen meat. We're expecting to get about 24 million pounds of these pre-boxed items in our warehouses through this program at the end of the year. It's been, we've actually had to lease an extra warehouse, hire some extra drivers, lease some vehicles, and it's been a tremendous addition to our mix of food that's leaving our warehouse out to our partners. In Denver County, of that 4 million pounds that was distributed between the May 20th and the end of June, we have almost 1.1 million has gone into Denver County specifically. The picture at the bottom of the box of the slide actually is what's in those boxes. So it's an amazing assortment. I believe it's about 25 pounds of produce in each of those boxes. So it's beautiful, beautiful produce. So yeah, it's been a really tremendous addition to our partners. Next slide. I just want to touch a little bit on what we're doing in Denver County specifically. So sort of the programs I spoke of earlier, we have 160 food pantries and congregate meal programs in the city and county of Denver, 38 after school programs, and that was as of the last school year, 19 summer programs, 29 Totes of Hope programs, 69 sites that are administering our senior boxes, and that number does not include any of our homebound deliveries. We have a team of volunteers and one full-time staff person that they do homebound deliveries to seniors, eligible seniors, and we are expanding that. 36 TFAP sites and 6 mobile pantries, including 3 at DHS locations that we have continued during this time as well. The food in the community, it's just amazing how much food is going out of this warehouse. We have seen record numbers. Our last, in June, we saw over 10 million pounds leave our warehouses, which is more, probably about 4 to 6 million more than a normal month for us. In fiscal year 2019, in Denver only, we distributed over 15 million pounds, which equates to about 13 million meals. Fiscal year 20, which just ended June 30th for us, that was increased to over 19 million pounds and 16 million meals. Just during the months from March to June, of that 19 million pounds, over 8.5 million was distributed to through our partners in the city and county of Denver. Next slide, please. And this is just kind of my wrap. So during these last few months, we have been blessed by generous donors, as well both financially as well as for time. We are still using volunteers in our warehouses, and we love volunteers. I mean, big heart to our volunteer teams that come in. You can sign up to volunteer on our website, and additionally, you can refer families in need of food through our website address, which is listed there, and also through Hunger Free Colorado and their food resource hotline. And again, this is my contact information if anybody has any questions about becoming a partner of Food Bank of the Rockies and or getting food assistance. I'm happy to respond to any and all inquiries there. That is all I have, Chris.
Awesome. Well, thank you guys. Thank you, Chris and Brett, for presenting just now. We do have some questions, so we're going to spend the last, probably about 15-20 minutes answering any questions. So if you do have some, please submit them. We have someone moderating them, and we'll get them out to our presenters. So these first questions are for Brett. Brett, so the first question is, does Hunger Free Colorado host community or RNO presentations? And if so, how do we arrange a presentation?
Yeah, absolutely. We're happy to present to any organization or group of organizations where that makes sense. And if you just shoot me an email, I'd be happy to talk to you about what sort of presentation is going to make the most sense for your needs. And so my email is Brett, B-R-E-T-T, at hungerfreecolorado.org. We'll be sure to get that in the chat as well as the follow-up materials. But more than happy to connect on any sort of additional presentations that would be useful.
Perfect, thank you. Another question for you, Brett, while we have you. This person states, I know a lot of families can barely make ends meet and are just a little over the income guideline for SNAP. How can we help those families?
Yeah, that's a great question. So SNAP is a means tested program, meaning that income is one of the eligibility criteria. I think one thing that's important for us to remember and know when we're helping folks try to get connected to SNAP is there's deductions though to that income. And so sometimes folks are eligible who don't think they would be once those deductions are taken into account. That's really where, whether it's the county folks definitely help with that, or it's Chris and her SNAP outreach folks, or Hunger Free. Part of our role, I think, is to ensure that folks are getting, who are eligible but might not immediately appear to be eligible, are getting the benefit, and that they're getting the benefit that they're entitled to. Right now, that's less of a deal because of the max benefit, but that'll go away eventually here. The other thing is there's a lot of other food programs out there, and Food Bank of the Rockies is just an excellent food bank in the area for that emergency food. So for folks who need food today, I'm hungry, I need food. There's pantries all across the state, and we can help connect to that, but so too can Food Bank of the Rockies, and they've got a great network of partners across the state. The other thing I'd say is that so Hunger Free lives in the food insecurity world for the most part, but one of the things we know is that people's budget doesn't just include food, and there's a bunch of other assistance programs out there that don't all have the same eligibility criteria, and so sometimes if you're not eligible for one, you could be eligible for another, and or even if you are eligible for SNAP, the additional help from other programs like CCAP, for example, the Colorado Child Care Assistance Program for folks with children can be make a big difference. So I would say, if someone is not eligible for SNAP, looking at other resources that are out there, and we can help get you connected to those for food, but also thinking about really individuals and families holistically, that if you're able to afford medicine and rent more easily, then you're more likely to be able to afford food as well. So that helps.
Perfect. Thank you so much. All right. So now we have a couple questions for Chris Taylor with Food Bank of the Rockies. First question being, how do people get CFAP?
Sure. That program, while it does come into our warehouse, these are the pre-boxed produce, dairy, and meat. They are distributed out through our partner agencies. We are getting several truckloads in a week, and we are moving it out as quickly as we can out to our partners. So it's just a matter of calling and reaching out to any of our food pantries and locating one near you to get that product.
Perfect.
There's no eligibility. Even though it's a government program, there's actually no eligibility on that program. No requirements.
Awesome. And another question for you, Chris. Does Food Bank of the Rockies deliver to seniors who are homebound? And if so, what are the age requirements and to which geographic locations? And then lastly, how does one apply for that program?
Sure. So we delivered our CSFP, which is our free grocery box for seniors. We do deliver those to homebound seniors. They need to be 60 years of age or older, and income eligibility, I'm sorry, I don't have that off the top of my head, but anybody can reach out to me for more information. They just need to reach out to our government programs team, and I can put that email address in the chat.
Perfect. And then this question is for either Brett or Chris. If someone has applied in the past and has been just over the income limit, what do they suggest that person do if they need food?
So if someone who's seeking food assistance can just go to our website or call Hunger Free or go to their website for resources for food assistance. You can search on our website based on your physical address, and it'll bring up a list of partners that are in the area.
Yeah, and I'd just echo that, Chris. So there's that emergency food need that can be met that way. And then, we encourage folks who are in need of food resources, even if they hadn't been eligible in the past, give us a ring so we can talk it through with them and see if maybe there's some deductions we missed or other solutions for the families. That's really part of the role of our food assistance navigators, is to try to get past those barriers. And I won't say that we always do, but we definitely want to go as far as we can to get people past those barriers.
Thank you. All right, so this question is over to Christian. So this person states, I've seen a lot of families experience barriers to benefits that require them to file for child support as a prerequisite. Why is that a requirement, and can an exception ever be made?
So great question, and the only requirement that I'm aware of in the context of the conversation that we're having right now is for those receiving Colorado Works to, and actually, let me take that back, because also childcare. Those two programs have a requirement to have a child support case. This is a decision at both the federal and state level, with the exception of CCAP, which is a little bit more complicated. So to answer your question, going all the way around my elbow to get to my thumb, there are exceptions for cases of good cause where like there's some extreme domestic violence or other issues that would not be in the best interest of the child or the family to participate in a child support case. This is a discussion that needs to happen between the caseworker, either at the child care, on the child care side or on the Colorado Works side. As far as the ability to make these exceptions, it's really at the department director and their delegates level to make that decision. So I hope that answers the question.
Thank you so much. We currently don't have any additional questions. I do want to give just a few more minutes to anyone that may not have submitted one. Again, just to remind everyone, this is being recorded. We'll be able to send out this presentation to anyone who needs it. We'll also be following up with any questions we may have missed or any additional information that our presenters would like to be sent along. We'll make sure that's sent to all attendees as well. Let's see here. Yeah, and if you have any additional questions later, say you're sitting around this lovely hot weekend and something comes up, you can always email our teams here at dhsnews@denvergov.org, and they'll make sure to answer any questions that you may have. Again, that's dhsnews@denvergov.org. Oh, and we have a question coming in here. So let's see. For an organization that does not focus on food, but works with low-income communities, what do you think is the best way to reach out to network, or excuse me, what do you think is the best way to reach our networks to increase awareness of these services? And that can be for anyone.
Chris, I can answer that. We do send out regular communications to our partner agencies, and so if there is a resource that would be beneficial to either the nonprofits or the clients that they serve that we work with, we're happy to share that information out. And it could just be emailed to me directly.
Okay, and Brett and Chris and Christian, actually, do any of you have any additional comments that you'd like to make prior to us ending this event?
I'd just like to say, thank you for having us, and thank you for allowing me to present, and I'm sure all the presenters feel the same way, and look forward to continuing our partnerships.
Yeah, and just to add on to that, you know, COVID-19 has been really challenging for everyone, I think, and I've seen some really difficult stuff, but also some of the most beautiful things in humanity through it. And a lot of that's through folks like you out there in the community doing really good work. And so while it's a challenging time, I'm also really heartened by all the great work that's being done in the community.
Yeah, very well said, Christian and Brett. I completely agree. I'm happy to be part of this group and look forward to seeing everybody in person someday soon.
Awesome. Well, with that, I just want to thank all of you for attending our very first virtual community network meeting. I'm happy you could all make it. And I did want to say to please, if you want any additional information, to follow either DHS or any of the agencies that were represented today on social media. I'm sure that they will have information and news and all of that there for you. So again, thank you so much. Have a most wonderful Friday. Have a wonderful weekend, and we will see you soon.